There are so many different types of thyroid malignancies. One among them is lymphoma of the thyroid gland. Usually, those patients who have been diagnosed as lymphoma of thyroid gland, they'll have a past history of Hashimoto's thyroiditis. So, Hashimoto's thyroiditis is one type of autoimmune thyroiditis. These patients, they'll be suffering from Hashimoto's thyroiditis for a long duration, which initially presents as hyperthyroidism, and later on it settles down as hypothyroidism, and most of the patients, they'll be on levothyroxine tablet for a long time. Now what happens is, in this type of patients, which affects elderly age group, say in their 50s or 60s, and most of them being female, and they have this thyroid gland enlargement for a long time, suddenly the thyroid gland becomes bigger in size and it starts growing very fast. And the patient presentation, the complaints will be, they have change of voice, which is not becoming normal, and they have associated cough too. And as and when it progresses, they have difficulty in swallowing, and it is neglected, it goes to the next stage, it will end up with breathing difficulty. Because of the size of the thyroid gland, it compresses all the important structures nearby. On examination, it will be seen the thyroid gland is enlarged, and by investigation we have to see how much of the surrounding thyroid gland, surrounding structures, and how much it has spread to different parts of the body. So, coming to the investigations. When you do a thyroid function test, it will be normal, because these Hashimoto's thyroiditis patients, already they will be on levothyroxine, that is T4 tablets. If suppose they are not, then in that case it will show hypothyroidism. Now when we do a ultrasound scan of the neck, the thyroid gland will be enlarged, and the radiologist, they will put in a needle and aspirate the contents and send it for histopathological examination. What I mean to say is fine needle aspiration cytology, which will give the report will be given, which will be like suspicious of lymphoma. We cannot come to a diagnosis of lymphoma. And even this suspicious of lymphoma after doing flow cytometry. Why I am saying like that? Because you need a full specimen tissue, not cells alone, for diagnosis of lymphoma. So with that we do flow cytometry and IHC also, immunohistochemistry also. Only when you do all this, we need to know the subtype of lymphoma to give the best treatment to the patient. Now, when you do an MRI scan of the neck, we can come to know how much of the thyroid gland is involved and how much of the surrounding structures are involved. Not only this, but we want to know how much the lymphoma, how much it is affected. Has it spread from the neck to different parts of the body, to the brain, to the abdomen, to the chest, to the pelvis? How much it has spread, we would like to know. So, for that, the latest investigation will be positron emission tomography combined with CT scan. So, already I have mentioned, for a diagnosis to be sure, we need excision biopsy, which we usually get by open biopsy only. Now, this positron emission tomography PET scan is not available in all towns or cities. So, usually what we do is, we used to take CT scan of the brain, neck, chest, abdomen and pelvis. Why? We need to stage the patient. So, depending upon the stage, the treatment goes on. That's why. So, we want to know whether the bone marrow is involved. So, we'll do bone marrow aspiration, which is usually done in the hip. With that, the investigation part is done. If you ask me which is the latest investigation, the answer is going to be next generation sequencing or liquid biopsy. The research is still on and it has not come into practice. Coming to treatment, to make it simple, I will present a different way, not stage wise, just simple as early stage and late stage. So early stage we manage with total thyroidectomy followed by radiochemotherapy, chemoradiotherapy. If it is late stage, thyroidectomy doesn't have much of role, because it's already spread throughout the body. So we need to do only treatment wise, it is chemoradiotherapy only combination. So the idea of this video is, those who have Hashimoto's thyroiditis, it can turn malignant at some stage. See, the good news is the latest scientific research shows that one study was done in which they sorted out, and it was a retrospective study and prospective study, in which the report was those patients who had Hashimoto's thyroiditis, it was not necessary that they should develop lymphoma. But those who have developed lymphoma, it was seen the past history, they had Hashimoto's thyroiditis. That means previously we had believed that these patients can develop lymphoma. But now it is believed that it is not necessary. The possibility of getting Hashimoto's patients, the possibility of getting lymphoma or it turning into lymphoma is very, very less. Is not common as it was thought of. So there is a good news for us. Anyway, the Hashimoto's thyroiditis patients, it's always good to be cautious. If there is lymph node, if there is thyroid enlargement, do not wait. Go meet your doctor once again, your family doctor who is taking care of you. Get an ultrasound scan done, FNAC, PET scan, and the earliest treatment, better the prognosis. That's why. Thank you so much.